name is Ashley, and I'm the manager of community engagement and training at the Alzheimer Society of Durham region. And I also wanted to welcome you to January, which is Alzheimer's Awareness Month. So I am pleased to be sharing some knowledge and education about Alzheimer's and dementia. So I always like to start with some numbers and some statistics about dementia. So currently there are more than 500,000 people living in Canada with some form of dementia, and that number is expected to grow over the next several years. There was a recent report out that suggested that that number will reach close to 1 million by the year 2030, so in 7 years now. And it is estimated that there are about 11,843 people who are living with dementia in Durham region alone. And again, that's only those that have been diagnosed and who report it. There are approximately 76,000 people diagnosed each year in Canada. And again, that number is growing. There's the number by 2030, almost 1 million. And that number has been inflated a little bit since these slides were made. And about 1 in 5 of us will experience being a care partner for a person living with dementia. So that doesn't necessarily mean a paid caregiver in terms of a PSW, but that could be being a care partner for a neighbor or a friend, a family member, a spouse. And it's anything from providing care to just checking on someone, dropping off groceries, any form of socialization. You are part of that care partner. So what is dementia? Well, dementia is this umbrella term that we use for any disease that causes changes in the brain that get worse over time. And these changes can include things like memory loss, problems with language, trouble with familiar tasks. And dementia is diagnosed when these changes start to affect a person's everyday activities. There is no single diagnostic test for dementia. Instead, a variety of other conditions are often ruled out first, which we will talk about shortly. Changes experienced by the person depend on where the damage takes place in the brain. People will experience dementia differently, and we often say if you've met one person with dementia, then you've met one person with dementia. And that's because, like I said, everybody experiences it differently. It is very unique to each individual. People progress differently. People show signs and symptoms differently. People go through the stages of dementia differently as well. There is actually estimated to be over 90 different types of dementia, and I will just quickly highlight the most common, the 4 most common. So our first one is Alzheimer's disease, which accounts for about 60 to 80% of all dementias. And the brain damage from Alzheimer's disease starts in the hippocampus of our brain, which is where we make and store our memories. And this is why short-term memory loss is often an early symptom. And then it slowly progresses to other regions of the brain. Our next most common is vascular dementia, and it accounts for about 20% of all diagnoses. And it occurs with mini strokes or when there is impaired blood flow to the brain. So depending on where the stroke occurs or which area of the brain was deprived of oxygen, that will determine which cognitive losses somebody experiences. Lewy body dementia is our 3rd most common, and it accounts for about 5 to 15% of all dementias. In Lewy body dementia, areas of the brain involved in movement and thinking are most affected. So a person may experience symptoms that are similar to both Parkinson's disease, such as rigidity or stiffness of their muscles, tremors or shaking, stooped posture, or slow shuffling movements. They may also experience symptoms that are similar to Alzheimer's disease, such as memory loss or the loss of language or reasoning. And we often see marked fluctuations in a person's alertness. So they may not have memory difficulties in the beginning, but generally it develops later on. And a person may experience visual hallucinations, such as seeing things that aren't there, such as bugs crawling on the wall or the ceiling or children outside playing. And our last one, our 4th most common, is frontotemporal dementia. And this one accounts for about 2 to 5% of all cases. And frontotemporal dementia is another umbrella term that we use for any rare disorder that primarily affects the frontal and the temporal regions of the brain. And these areas are generally associated with personality, behavior, emotions, language, speech, abstract thinking, and movement. We often think of dementia as being an old person's disease, but this is not true. People in their 30s, 40s, 50s, and 60s are diagnosed with dementia every day. And this is known as young onset dementia. So if you receive a diagnosis under the age of 65, it's classified as young onset dementia. And interestingly, about 20% of all frontotemporal dementias are in those under the age of 65. So what's most common amongst all types of dementia is that there is no cure and that they are progressive, meaning they will get worse over time. So like I mentioned, there are treatable conditions that can cause symptoms similar to dementia that a doctor will rule out when trying to figure out if it's dementia or if there's something going on. And these are things like depression, and this can mimic dementia with symptoms such as mood changes or personality changes, apathy, loss of ambition, or social isolation. Infection or delirium can cause severe dementia symptoms in a very short time period. Often we see this in a matter of hours or in half a day or from night to day. And this is often seen in untreated urinary tract infections. Medication side effects can also cause symptoms that are similar to dementia as well. If someone's not taking their medication properly, not taking it on time, taking too much or too little. Sometimes it's a drug interaction as well. And then things like metabolic disorders, vision or hearing impairment, if left untreated, can cause disorientation and confusion. Things like sleep disorders or sleep apnea, sleep deprivation, insomnia. Nutritional disorders such as vitamin or dietary deficiencies can cause symptoms of dementia as well. In general, we talk about warning signs of Alzheimer's disease or dementia in terms of 10 warning signs. The first one there is memory loss that affects day-to-day abilities, and I apologize that the pictures are small. But memory loss that affects day-to-day abilities. So forgetting things often or struggling to retain new information. Maybe they ask the same question multiple times, and that's because their brain can no longer hold those short-term memories or that information that you just gave them. The second one there is difficulty performing familiar tasks. So forgetting how to do something you've done your whole life, such as preparing a meal or getting dressed. Problems with language is the third one, and that's forgetting simple words or substituting words that don't fit the context. So the person may say, "Where's my cold?" but they may mean, "Where's my sweater?" because they're cold. Or they may call a cat a dog, or they can't find the right name for something. Disorientation is another sign, and this is disorientation in time and space. So not knowing what day of the week it is or getting lost in a familiar place is a common one. We've often heard about people who go for a walk every day and take the same route, and now they start to get lost. That would be cause for concern. Impaired judgment, so not recognizing a medical problem that needs attention, or maybe they're wearing light clothing on a cold winter day or too much clothing on a hot winter or on a hot summer's day. Problems with abstract thinking is our first one on the bottom row here. And that's having difficulty doing things like balancing a checkbook or not understanding what numbers are for, what they're used for. Difficulty, paying a bill or making change if they're paying cash for something. Misplacing things in unusual places is a common one. So putting things in strange places, like in that picture, she's putting her dress in the fridge. Maybe she thinks it's a closet, or their wristwatch in a sugar bowl or jewelry in a sugar bowl because it looks like a jewelry box. Changes in mood and behavior. So exhibiting severe mood swings from being easygoing to quick-tempered. 1 minute they may be laughing, to the next minute they're crying or they're angry, and there's no apparent reason for that. Changes in personality is our second last one, and that's acting out of character. They're confused, suspicious, or even fearful. And our last one there is loss of initiative. So losing interest in their friends, their family, or their favorite activities. Maybe the person used to attend church every Sunday, and now it appears they no longer have any interest. So some risk factors for dementia. So just important to note that risk factors are aspects of our lifestyle or environment or our genetic background that contribute to the likelihood of getting a disease, but risk factors on their own don't cause a disease. They represent an increased chance, but not a certainty. And similarly, having little or no exposure to known risk factors doesn't necessarily protect a person from developing a disease as well. So on the right-hand side there, we have non-modifiable risk factors. And these are things that we cannot change. So things like our genetics or our medical history, if someone has Parkinson's or liver disease, and our gender. So women make up about 2/3 of all dementia cases. And then on the left-hand side there, we have modifiable risk factors. And these are things that are within our control that we can change. Things like high cholesterol levels in our blood, high blood pressure, diabetes, smoking, obesity. Those are the major modifiable risk factors for cardiovascular disease, including heart disease and stroke. And if we can reduce our risk of a stroke, then we can reduce our risk of developing vascular dementia, for example. Hearing loss is on there as well. So hearing loss can significantly increase one's risk of developing dementia. So if people aren't able to hear properly, their brains aren't firing at the same rate that somebody who can hear properly. And we learned on the other slide about other conditions that cause symptoms similar to dementia. Hearing was on there as well. If someone can't hear properly, they may present as being confused or disoriented. So a good way to remember these is what's good for your heart is good for your brain. So making sure you're eating a good diet and keeping your cholesterol levels monitored, things like that. Medications as well, taking them properly. So diagnosis and treatment, if someone or if you yourself have any of those warning signs that we talked about, it's important to get medical attention so that those medical conditions that we also talked about can be ruled out and that the right supports can be put into place for you. As I mentioned, there is no single test that can tell if a person has dementia. So the diagnosis is made by eliminating other possible causes. And early diagnosis and treatment has some very promising results, which can help the person living with dementia to continue to engage in those activities that they enjoy. And it may also slow down the progression. Medications prescribed in dementia help treat the symptoms of the disease only. So there is no cure, there is no way to reverse it. But it is important to note that there are medications that can help alleviate some of those symptoms. But also we want to take into consideration that not all medications are appropriate for everyone. And so the decision about which treatments to use really need to be made between a doctor and the patient. The type of dementia, other medications that a person's on, or other medical conditions are just some of the factors that would be considered into making that decision about whether the medication is right or not. Some people also consider using natural health products as an alternative treatment. And we always like to add caution here that there may be many factors to consider when choosing the right treatment. Again, what works for one person may not work for another, or it may even worsen or cause harm to another person. So things like natural remedies, people often talk about those or ask questions about those. And natural remedies can change the way that prescription drugs work. So it's important to tell your doctor or your pharmacist about any natural products that you might be taking and make sure that you ask them about possible side effects or interactions with medications. It's important to remember that dementia is not a normal part of aging. While most of us will notice some changes as we age, the more serious concerns related to dementia do not happen for everyone and cannot be explained as a normal part of aging. So for example, it is a normal part of aging to forget details about a conversation that happened a year ago. However, I apologize for my Dutch. However, forgetting things or events that happened recently can be cause for concern. Or when details are forgotten more frequently, you may forget where you put your keys, but with dementia, you forget what your keys are for. Just give me 1 second. I'm so sorry. Oh, there we go. With normal aging, you may forget an acquaintance's name, but with advanced dementia, you'll forget the people that are close to you, for example. And with normal aging, you may be worried about your memory because you're noticing the changes. But a more serious concern is when your relatives start to notice changes in your memory that you may not be noticing. So supporting the person living with dementia, it may be your spouse, your parent, family member, friend, or neighbor, but regardless of who it is, we always want to try to remember that they are still people too. And we should always treat others how we would want to be treated. So we need to remember to be patient, remember that it's not their fault. It's not their fault that they're asking the same question or that they forget who you are. Although it can be frustrating, sometimes it's best to just step back from the situation if you can. Sometimes it takes the person living with dementia longer to process information, so we want to be sure to give them time to answer. If you have to repeat a question or a comment, we want to make sure that we do it the same way, and changing up the wording can cause confusion and frustration because we're now asking their brain to process 2 pieces of information. We also want to avoid saying, "Don't you remember?" or correcting people if they said the wrong thing. Many people living with dementia have difficulty word finding and they may mix up the message. They may say, "I'm waiting for my mother," for example, when really we know maybe they're waiting for their wife. And again, it's best not to correct them as this can cause frustration for them. It's best to just live in their world. And we always want to give people living with dementia choice. Instead of saying, "What do you want to do?" where those options are endless and their brain may not be able to focus on one thing, we may say, "Do you want to go for a walk or do you want to play a game?" So we give options, A or B. We can also give examples and choice as part of your questions, which really help a person living with dementia focus on what we're asking them. Sometimes asking those open-ended questions can just be a bit too overwhelming. So I wanted to talk a little bit about creating dementia-friendly communities. So a dementia-friendly community is a place where people living with dementia and their care partners are welcomed, included, and supported. It's a community that pays attention to the social and physical needs of the person living with dementia. It's about the physical environment and how we speak to and interact with people living with dementia. And it's about our understanding of dementia. At the Alzheimer Society, we work with local businesses and establishments to train their staff on how to create dementia-friendly communities. And also part of becoming a dementia-friendly community is understanding that there is a risk for a person living with dementia to get lost or to go missing. And it's also a great opportunity to talk about how we support those who may be lost. In order for people living with dementia to live well in their communities, they need to be safe. And we're all a part of making that happen. 3 out of 5 people living with dementia will go missing at some point in the disease. And this can happen at any point, and it can even happen early on as well. 50% of people living with dementia who are not found within the first 24 hours will experience serious injury or even death. And therefore, learning about how to identify someone who is living with dementia, how to interact with them, really helps to create a dementia-friendly community where people feel supported to continue to be engaged in the things that they've always done and the things that they enjoy doing. So there's lots of other ways that the Alzheimer Society can help as well. The Alzheimer Society has lots of great programs and services, most of which are free. And we can provide education on a variety of topics or cater it specifically to your needs, whether it would be in a one-to-one or a group session. There's also great counseling supports as well, and those are available in a group setting or one-to-one as well. And we do have a young onset adult day program and other recreation programs available for people living with dementia. Our services are available in French, and we do offer a respite program. And we also do have memory clinics in Oshawa, Bowmanville, and Scarborough. The Alzheimer Society of Durham is also a not-for-profit organization, so all donations help us to continue to support our community members and the needs that they have. If you're interested in donating, please feel free to visit our website for more information. We're always looking for feedback and would love if you could take a couple minutes to complete this short survey about today's presentation. Catherine, I'll also email you the link as well to send to the participants. But if you have a smartphone handy, you can take a picture with your camera of the little QR code, or you can visit the website there. So that is it. Thank you so much for joining today. Catherine, I'm happy to answer any questions, or if anyone wants to connect, I have posted my contact information on the screen as well.